Your doctor pulls up your latest lab results, looks at one number and says, "It's a little high, let's keep an eye on it." That number is your A1C. And here's what makes it different from your daily blood sugar reading. Your A1C doesn't lie. It's not a snapshot. It's a 3-month average of every meal, every snack, every late night decision you made, coded right into your red blood cells. Now, if you're watching this video, chances are that number is either already elevated or someone in your life is worried it's heading that direction. And what you've probably been told is, eat less sugar, exercise more, and come back in 3 months. That advice isn't wrong, but it's incomplete, especially if you're over 60. Because after 60, your body controls blood sugar differently than it did at 40. The same meal that was fine a decade ago can now push your A1C in the wrong direction, not because you changed, but because your physiology changed. Today I'm going to show you 5 specific foods that work with that changed physiology, not against it. Foods that lower A1C by targeting the actual biological mechanisms that shift as we age. And I'll tell you right now, food number 3 surprises almost every patient I sit down with. It's probably already in your kitchen or a 10-minute drive from your house, and the research behind it is fascinating. Stay with me through this whole video because at the end I'm going to give you one more tool, a timing strategy that makes all 5 of these foods work significantly better. No extra foods, no extra effort, just timing. Let's get into it. Before we get to the foods, I need to spend 2 minutes making sure we're talking about the same thing, because most of what you've heard about blood sugar management was designed for a 45-year-old, not a 65-year-old. Here's what A1C actually measures. Your red blood cells carry a protein called hemoglobin. When glucose floats through your bloodstream, some of it sticks to that hemoglobin. The more glucose in your blood over time, the more gets stuck. Your A1C is simply the percentage of your hemoglobin that's been coated in glucose over the past 90 days. Under 5.7%, normal. Between 5.7 and 6.4, pre-diabetes. At or above 6.5, that's the diabetes diagnosis threshold. Now here's where age changes everything. Your muscles are the single largest glucose disposal system in your body. When you eat carbohydrates, roughly 80% of that glucose gets cleared from your blood by muscle tissue, pulled in by a transporter called GLUT4. Muscle is your blood sugar's primary destination. But after 60, most of us have lost a significant amount of muscle mass. This process is called sarcopenia, and it's natural, but it means your body simply has less capacity to absorb glucose after a meal. The glucose has nowhere to go as quickly. It stays in your bloodstream longer, and your A1C reflects that. This is why I have patients who tell me, "Doctor, I haven't changed anything about how I eat, but my A1C went up anyway." And they're not lying, they're right. They didn't change. Their physiology changed around them. On top of that, insulin signaling becomes less efficient with age. Your pancreas may still produce adequate insulin, but the cells don't respond to it as sharply. This is age-related insulin resistance, and it compounds the muscle mass problem. The practical result? Post-meal blood sugar spikes stay elevated longer in a 65-year-old than in a 45-year-old eating the exact same meal. So when I tell you these 5 foods are especially effective after 60, I mean it specifically. They're not just generally healthy. They work on these exact mechanisms: the glucose absorption rate, the insulin sensitivity at the receptor level, and the inflammatory environment that blocks insulin signaling in aging tissue. Now let's go through them. Food number 1 is something you've almost certainly heard of, but probably not for the right reasons. Oats. I know, you've heard, eat oatmeal, it's good for you. But I want to explain why oats lower A1C specifically, because it's not what most people think, and the how you prepare them matters enormously. The active compound in oats is a type of soluble fiber called beta-glucan. When beta-glucan reaches your digestive tract, it absorbs water and forms a thick, viscous gel. Imagine the consistency of that oat water that forms when you soak oats overnight. That gel coats the lining of your small intestine and significantly slows the rate at which glucose gets absorbed into your bloodstream. Instead of a sharp glucose spike after your meal, you get a gentle, gradual rise. Your pancreas doesn't have to scramble. Your cells have time to respond. And over 90 days, those smaller, smoother curves add up to a measurably lower A1C. Multiple clinical trials have confirmed this. A meta-analysis published in the European Journal of Nutrition found that regular oat consumption was associated with meaningful reductions in both fasting blood glucose and A1C levels in people with type 2 diabetes and prediabetes. Now, here's the part that most oatmeal conversations miss. Not all oats are equal. The more processed an oat is, the faster it digests and the less time that beta-glucan gel has to do its job. Instant oats are the worst choice for blood sugar. The oat has already been broken down so thoroughly that it behaves almost like a refined grain, fast digesting, quick to spike glucose. Rolled oats are better. Steel-cut oats, which are just whole oat groats chopped into pieces, are best. They take longer to cook, but they produce a significantly lower glycemic response. Here's a bonus tip for people in a hurry. Overnight oats made with rolled oats fall somewhere between rolled and steel-cut in terms of glycemic impact. The overnight soak partially breaks down the structure, but not nearly as aggressively as cooking. A reasonable middle ground. Now here's the 60+ specific angle on oats that I find genuinely interesting. Digestion naturally slows as we age. Gastric emptying, the rate at which food leaves your stomach, is slower in most adults over 65. Normally we think of slower digestion as a problem, but with beta-glucan, it actually extends the window in which that viscous gel stays in contact with your intestinal wall. Your gut holds on to it longer. For once, the aging digestive system is working in your favor. Practical guidance. Half a cup of dry, steel-cut or rolled oats daily. Never eat oats alone. Add protein, a boiled egg on the side, a spoonful of almond butter, or some walnuts on top. And yes, walnuts are coming up next. Protein further blunts the glucose response and keeps you fuller longer. Avoid flavored instant oat packets. Most contain added sugar that completely cancels the benefit. If you find steel-cut oats take too long, cook a large batch on Sunday and refrigerate portions for the week. Food number 2 is one of the most underestimated tools I know for blood sugar management in older adults. And it's something that costs about $4 at any grocery store. Vinegar. Apple cider vinegar specifically gets most of the attention, but the evidence actually applies to any vinegar, white vinegar, red wine vinegar. The active compound is acetic acid, and it's present in all of them. Here's how it works. When you eat starchy foods, bread, rice, potatoes, pasta, your body uses enzymes called amylase and sucrase to break those starches down into simple sugars that can be absorbed. Acetic acid inhibits both of these enzymes. It slows the entire process of starch digestion. The result is the same principle we saw with oats. Glucose enters your bloodstream more gradually. The spike is smaller. And over 3 months, smaller spikes mean a lower A1C. A landmark study out of Arizona State University published in Diabetes Care showed that consuming 2 tablespoons of apple cider vinegar before a high-carbohydrate meal reduced post-meal blood glucose by up to 34% in people with insulin resistance. 34% from 2 tablespoons of vinegar. Now, let me address something specific to people over 60, because this is why I include vinegar as an age-targeted recommendation, not just a general one. As we age, a class of gut hormones called incretins, particularly GLP-1, which you may have heard about in the context of newer diabetes medications, become less effective. GLP-1 normally slows gastric emptying and signals the pancreas to release insulin in response to a meal. That response weakens with age. Acetic acid partially compensates for this. It slows digestion independently of the incretin system through a mechanical, enzymatic pathway that doesn't rely on hormone signaling. For an older adult with a blunted incretin response, this is a meaningful workaround. Let me be direct about one thing before we move on. If you've seen apple cider vinegar capsules or gummies at the pharmacy, skip them. The research is almost entirely based on liquid vinegar. The acetic acid concentration in capsule form is inconsistent and the bioavailability is not comparable. If you want the blood sugar benefit, use the liquid. Practical guidance. 1 to 2 tablespoons diluted in a full glass of water, 8 ounces minimum. Never drink it straight. Take it 15 to 20 minutes before your highest carbohydrate meal of the day, usually lunch or dinner. If the taste bothers you, mix it into a salad dressing instead. Same effect. One important caution: vinegar is acidic. Do not drink it undiluted. It can damage tooth enamel and irritate the esophagus. If you have a history of acid reflux or GERD, check with your doctor first. If you're already on blood sugar medications, monitor your readings when you start. Vinegar can lower glucose meaningfully. That's a good thing, but you want to be aware of it. Alright, food number 3. This is the one I mentioned at the start of this video, the one that surprises almost every patient when I bring it up. Okra water. I see that look. Stay with me. Okra, the vegetable, has been used medicinally for blood sugar management in traditional medicine systems across West Africa, the Caribbean, and South Asia for generations. But in the last decade, researchers have started putting those traditional claims through rigorous testing, and the findings are hard to ignore. Here's the mechanism. When you cut okra or soak it in water, it releases a thick, slightly gelatinous substance called mucilage, the same thing that makes cooked okra slippery if you've ever had it in a stew. This mucilage works similarly to the beta-glucan in oats. It physically binds to glucose in the intestinal tract and slows its absorption into the bloodstream. But okra has a second mechanism that oats don't have, and this is where it gets genuinely interesting for people over 60. Okra contains a flavonoid compound called myricetin. In preclinical research, myricetin has been shown to activate GLUT4 transporters, those same glucose transport proteins I mentioned earlier that pull glucose out of your blood and into your muscle cells. Remember how I said muscle mass declines with age, and with it the capacity of those GLUT4 transporters to clear glucose? Myricetin appears to upregulate that transporter activity, essentially helping the glucose disposal system work more efficiently even in aging muscle tissue. A study published in the Journal of Pharmacy and Pharmacology found that mice fed okra extract showed significantly reduced blood glucose levels, and the effect was attributed specifically to GLUT4 activation. Human trials are still limited, but the mechanistic pathway is consistent with what we see clinically. Now, how do you actually use this? The most studied preparation is okra water. You take 2 to 3 whole okra pods, cut off the tips and tails, slice them in half, and place them in a glass of water overnight. In the morning, squeeze the pods into the water and drink it before your first meal. It has a mild, slightly green taste, not unpleasant, and the preparation takes about 45 seconds the night before. If you'd rather eat the okra itself, that works too. Sautéed or roasted okra retains much of the myricetin and fiber content. The one thing to avoid is deep frying, which degrades the beneficial compounds and adds unhealthy fat that creates a separate set of problems. Practical guidance. 2 to 3 okra pods soaked overnight in water, drink before breakfast. Alternatively, eat sautéed okra 2 to 3 times per week. Find it at most grocery stores in the fresh produce section or at Caribbean and Southern food markets. No known drug interactions at food consumption levels, generally very safe. Food number 4 is one I recommend to almost every patient I see for blood sugar management, and the reason has less to do with the carbohydrates in the walnut and more to do with what walnuts do to the environment in which your cells receive insulin. Let me explain. There is a phenomenon in aging biology called inflammaging, chronic low-grade inflammation that accumulates over decades. It doesn't feel like the inflammation from a sprained ankle. There's no redness, no obvious pain. But at the cellular level, inflammatory signaling molecules called cytokines are quietly interfering with how your cells respond to insulin. Specifically, inflammatory cytokines like TNF-alpha and IL-6 block insulin receptor signaling. They physically interfere with the molecular handshake between insulin and your cells. The result is that even if your pancreas is producing adequate insulin, your cells are less able to hear it. Classic insulin resistance, driven not by diet, but by the inflammatory landscape of an aging body. Walnuts address this at the root. Walnuts are one of the richest plant sources of ALA, alpha-linolenic acid, an omega-3 fatty acid. They also contain elagitannins, a class of polyphenols that your gut converts into urolithins, compounds with potent anti-inflammatory properties. Clinical evidence supports this connection directly. A 2018 study published in Diabetes and Metabolism found that regular walnut consumption was associated with a 47% reduction in the risk of type 2 diabetes in a large prospective cohort. Multiple smaller trials have shown measurable reductions in fasting glucose and insulin resistance markers. Now, I want to make a distinction here, because patients sometimes ask me, can I just eat almonds instead, or cashews? Almonds and cashews are nutritious foods, but they have a different fatty acid profile. They're higher in monounsaturated fats, but significantly lower in ALA, and their polyphenol content doesn't produce the same anti-inflammatory cascade. For the specific mechanism of reducing insulin resistance driven by inflammaging, walnuts stand apart. Practical guidance. 1 ounce per day, that's about 7 whole walnuts or a small handful. Eat them with a meal rather than as an isolated snack. The fat and protein in walnuts eaten with carbohydrates further blunts the glucose response from that meal. Morning or lunch timing is preferable. You'll see why when we get to the bonus section on meal timing. Store them in the refrigerator or freezer. The omega-3 fats in walnuts oxidize faster than other nuts, and stale walnuts lose some of their beneficial properties. Don't eat them as part of a sweetened trail mix or candied walnut recipe. Plain is best. Food number 5 is the one with the most dramatic biochemistry on this entire list. And if you're familiar with the most commonly prescribed medication for prediabetes and type 2 diabetes, what I'm about to tell you is going to be very interesting. Bitter melon. Bitter melon, also called bitter gourd or goya in Japanese, is a vegetable that looks like a warty, bumpy cucumber. It's used widely in Asian, South Asian, and Caribbean cuisine, and it has been studied extensively for blood sugar management for decades. Here's what makes bitter melon remarkable. It contains 3 distinct active compounds: charantin, polypeptide P, and lysine. Charantin has been shown to have a glucose-lowering effect comparable to some early diabetes medications. Polypeptide P is sometimes called plant insulin because of its structural and functional similarities to human insulin. But the most clinically significant mechanism is this. Bitter melon activates an enzyme called AMPK, AMP activated protein kinase. If that name sounds familiar, it's because AMPK is the same enzyme that metformin activates. Metformin, the first-line medication doctors prescribe for prediabetes and type 2 diabetes, works primarily by activating AMPK in liver and muscle tissue. That activation increases glucose uptake, improves insulin sensitivity, and reduces the liver's production of excess glucose. Bitter melon activates the same pathway, through different molecular mechanisms, but the same downstream target. I want to be precise here. I'm not saying bitter melon replaces metformin. Medication doses are calibrated, standardized, and monitored. Food is not. But what I am saying is that the mechanism is real, it's documented, and for someone in the pre-diabetes range who hasn't yet started medication, this is a meaningful, natural intervention. Why is this especially relevant after 60? AMPK activity naturally declines with age. It's one of the defining metabolic shifts of aging. Reduced AMPK signaling means cells become less efficient at taking up glucose, the liver becomes more prone to overproducing glucose at night, and insulin sensitivity decreases. Bitter melon works precisely in this gap. A meta-analysis published in the Journal of Ethnopharmacology reviewed human clinical trials on bitter melon and blood glucose. The findings showed consistent reductions in fasting blood glucose and A1C levels across multiple studies, particularly in people with prediabetes and early-stage type 2 diabetes. Practical guidance. You can find bitter melon at most Asian grocery stores. Indian, Chinese, Korean, Filipino, and Caribbean markets typically carry it. The most accessible way to eat it: slice thinly, stir-fry with garlic and a small amount of olive oil. The bitterness mellows significantly with cooking. Bitter melon juice is more potent but has a strong taste. If you're interested in juice form, start with a small amount mixed into another vegetable juice. 2 to 3 servings per week is sufficient. You don't need daily consumption for meaningful effect. One important safety note: because bitter melon activates similar pathways to diabetes medications, if you are already on metformin, insulin, or any other blood sugar medication, do not add significant amounts of bitter melon without telling your doctor. The combined glucose-lowering effect could be stronger than expected. This is a good conversation to have at your next appointment. Now I want to show you something that happens when you combine these foods, because individually, each one moves the needle. Together, they create what I call an A1C stacking effect. Look at the mechanisms side by side. Oats work by slowing glucose absorption through beta-glucan gel formation. Vinegar works by inhibiting the digestive enzymes that break starch into sugar. Okra works through mucilage binding and GLUT4 activation. Walnuts work by reducing the inflammatory interference with insulin receptors. Bitter melon works by activating AMPK to improve cellular glucose uptake directly. These are 5 different entry points into the blood sugar regulation system. When you combine 2 or 3 of them in a single meal, you're attacking the problem from multiple angles simultaneously. Here's a simple example of what that looks like in practice. Breakfast: steel-cut oatmeal, a handful of walnuts stirred in, 1 boiled egg on the side, preceded by a glass of okra water from the night before. That single meal combines 3 mechanisms: beta-glucan slowing absorption, walnuts reducing inflammatory insulin resistance, and okra's GLUT4 activation. 3 pathways, 1 breakfast. Before lunch, a glass of water with 1 tablespoon of apple cider vinegar 15 minutes before eating. Dinner 2 or 3 times a week, a stir-fried dish that includes bitter melon alongside your protein and vegetables. You don't have to implement all of this on day 1, but over 90 days, the exact window your A1C measures, these combined inputs add up to a meaningful shift in that number. I promised you a bonus at the start of this video. Here it is. All 5 of these foods become more effective when you eat them in alignment with your body's natural insulin sensitivity rhythm. This is called circadian metabolic timing, and the research on it has accelerated significantly in the last 5 years. Here's the core finding. Insulin sensitivity is highest in the morning and declines across the day. The same meal that produces a moderate glucose response at 8 a.m. can produce a significantly higher spike at 8 p.m. because by evening, your cells are naturally less responsive to insulin. For adults over 60, this effect is amplified by the dawn phenomenon, a natural cortisol-driven rise in blood sugar that occurs in the early morning. Managing that morning window correctly sets the metabolic tone for the entire day. What this means practically. Load your carbohydrates earlier in the day. Your highest carb foods should be at breakfast or lunch, not dinner. If you're eating oats, eat them in the morning. If you're having vinegar water, take it before your largest carb meal, which should be earlier, not later. Keep dinner lighter on carbohydrates, and if you're having bitter melon or okra, those are excellent dinner additions because they help manage the slower nighttime glucose clearance. A growing body of research suggests that simply shifting caloric and carbohydrate intake toward the morning without changing what you eat can reduce A1C by 0.3 to 0.5 percentage points over 90 days. For someone sitting at 6.1 or 6.2, that could be the difference between prediabetes and a normal reading. This topic of meal timing for blood sugar in people over 60 deserves its own video, and I'm building that one right now. Because there are specific time windows down to the hour that make a measurable difference in your A1C without any changes to what you eat. If you want to see that video when it's ready, make sure you're subscribed and have notifications turned on. Let's bring this home. At the beginning of this video, I described a scenario a lot of you know. Your doctor looks at your A1C, says it's creeping up, and sends you home with general advice and a follow-up appointment. What I hope you're leaving with today is something more specific than that. 5 foods, each targeting a distinct mechanism that give your body real tools to reverse that trend over the next 90 days. Oats for their beta-glucan fiber that flattens glucose absorption. Vinegar for blocking the enzymes that spike your blood sugar after a starchy meal. Okra water for binding glucose and activating the GLUT4 transporters your aging muscles need. Walnuts for addressing the inflammatory root cause of insulin resistance, and bitter melon for activating the same metabolic pathway your doctor may eventually prescribe a medication to hit. Combined, timed strategically, and eaten consistently, these are not small inputs. The research supports meaningful A1C reductions over a 90-day window. One final note. If you are already on diabetes or prediabetes medication, please talk to your doctor before adding significant amounts of bitter melon or vinegar to your daily routine. Not because they're dangerous, but because they work and the combination with your medication deserves monitoring. If you found this video useful, and I hope you did, please consider sharing it with someone in your life who's managing blood sugar. You might be giving them something their doctor hasn't had time to explain. Hit the like button. Leave me a comment telling me which of these 5 you're going to try first. I read every one. And subscribe if you haven't already. Every week on this channel, I bring you one evidence-based, age-specific change that genuinely moves the needle. I'll see you in the next video.